and welcome to our special show. Diabetes in India is a growing health problem, with more than half of our population at risk of developing the condition at any given time in their lives. Diabetes mellitus is a widely diffuse chronic condition that impacts several aspects of a patient's life. If you do not manage this condition, you may develop more severe complications. And it's of course well known that there's no cure for diabetes, so it all depends on a well-managed lifestyle. If with well-managed diabetes, you can prevent many complications. Diabetes management is about more than just food, blood sugar control. Most people are still unaware about this fact. There's much debate about the cure and the reversing of diabetes. People are being misled by half-truths or inaccurate information. There are several misconceptions about diabetes management and treatment, and so it's important that people get correct information about this. And so we've put together an eminent panel to discuss these and other issues regarding diabetes, and we have today with us an esteemed panel of experts. Now, before I go into them, if you have any questions that you've had in your mind about diabetes, this is your chance, this is the opportunity for you to put them across to the best in the business. If you'd like to ask them, you can send them to us via WhatsApp to the following number that's flashing on your screen right now. That's the number for you to send us your questions for our experts. And of course, don't forget to send us your name and your location where you are reaching out to us from. So let me introduce our panel today. We have Dr. Sujoy Ghosh from the Department of Endocrinology at IPGMR in Kolkata, an honorary secretary of the Endocrine Society of India, joint secretary of the RSSDI program, director of type 1 diabetes task force of the government of West Bengal. We have Dr. Sunil Gupta, the national president of DIPSI, that is the Diabetes in Pregnancy Study Group of India, national treasurer of RSSDI, senior diabetologist at Nagpur. We have Dr. N.K. Singh, director of diabetes and the Heart Research Center in Dhanbad, the chairperson of RSSDI Jharkhand. And of course, all of you so qualified, so many designations. I need a sip of water before we can start. But first, I want to start with a WhatsApp question for Dr. Ghosh from Lakshmi Narayanan from Chennai, who says, I'm a senior citizen I'm a diabetic with high blood pressure. I was affected by COVID last month. When can I take my booster shot?
First of all, a very good afternoon, and thank you for having me on the show. I think that's a very common question that a lot of our patients keep on asking. Now, technically speaking, if you've had COVID at any given point of time, we would assume that you have developed enough immunity and antibodies to combat COVID, at least for some period of time. So one of the things that is being advocated, not just in India by the government of India, but elsewhere as well, that you provide a gap between your infection and the next dose, because you would automatically be protected for the next 3 months or so. So it's best that you avoid taking the next shot for 3 months. After 3 months, go and take the next shot of your booster dose, because you having high blood glucose and having diabetes and having hypertension, these are comorbidities which puts an individual at a greater risk of having complications related to COVID. Therefore, do take the shot, but after 3 months.
All right, that makes sense. You should protect yourself as much as you can. So if you have the antibodies, may as well wait for 3 months. I hope that answers your question, Lakshmi. Let's go across to Dr. Singh. High blood sugar levels are the key problem in diabetes. Many people often wonder why there's a need to take more than one pill for just blood sugar management. Why is one medicine not enough for type 2 diabetes treatment, Dr. Singh?
Yeah, good afternoon. I think this is a very, very pertinent question in our patient's mind. So the concept of diabetic treatment has totally changed these days. It is not only the glucocentric, number one. Diabetes blood sugar is not only the sugar thing. It is a cardio-renal metabolic problem. So there are two things which I will tell you. The first, if the single drug is not working in a normal diabetic without complications, then definitely you have to add the drugs which work with different mechanisms, and then we can control the blood sugar That is the one portion. But the major change which has occurred in the, I think, within last 5 to 10 years, that is that you have to prevent the cardiorenal metabolic complications. These are the major issues by which the diabetic has become responsible for kidney, major cause of the kidney failure, cardiac problem, heart failure. So I think we have got recent very new drugs like SGLT2 inhibitors and GLP-1 agonist, and these drugs have given us a very important message that from the very beginning, if you are coming with a high risk profile group of diabetes, you must take it so that your life can be prolonged, your kidney failure can be halted, and even we can halt your heart failure and the cardiac problems. So this is the major thing which our patient must understand. Thank you.
All right, I want to go across to a technical question now for Dr. Sunil. Is it true that short-term intensive insulin therapy can improve pancreatic beta cell functions when administered early in type 2 diabetes mellitus, Dr. Sunil Gupta?
Yeah, thank you very much for this very clinical question. I don't think it's very difficult question for even laymen to understand. When we talk about type 1 diabetes, then one thing should be very, very clear that every person with type 1 diabetes need to be on multiple doses of insulin, maybe 4 pricks per day. But when it comes to type 2 diabetes, at the time of diagnosis, suppose someone comes to you with fasting blood glucose of say 250, 2 hour postprandial blood glucose of more than 350, HbA1c of more than 10, we presume that this is a situation where their beta cells are highly exhausted. A layman should understand that beta cells of pancreas, they secrete insulin. When your blood glucose is very high, that means to combat this situation in your own system, your beta cell try to secrete more and more and more insulin, and they get highly exhausted. In such situation, despite knowing that you have enough beta cells still available, but they are highly tired. And that is why you should try to support them with insulin therapy for a short while, maybe for 6 weeks, maybe for 4 weeks, maybe small dose of insulin 2 to 3 times a day can be good enough for them, along with maybe metformin if the person is obese, or some other drug, but not sulfonylurea. So we don't want to exhaust an already exhausted horse here. And that is why we give a short-term insulin therapy to give rest to the beta cells. Once these beta cells, they take enough rest, then you can withdraw insulin and they can do well with simple metformin and sometimes gliptin and some other drugs, SGLT2 inhibitors, which can really save your beta cell for a longer period. So to improve, to keep the beta cell healthy, to keep them alive for a longer period. Otherwise, it has been shown and documented in multiple evidences that if you start tablet in such situation, especially sulfonylurea, then these beta cells may get exhausted early and may land up with oral anti-diabetic agent inadequacy or failure in near future, and they may need to be taken insulin for a longer period, maybe for the whole life. And that is why in such situation, give short-term insulin therapy, rest to the beta cell, improve the health of the beta cell. The glucose, one should be very, very clear here. Glucose itself is toxic to the beta cells. High cholesterol lipid itself is toxic to the beta cell. We call it as glucotoxicity or lipid toxicity. Now both of these toxicities may further deteriorate the health of the beta cells, and that is why we should try to first control blood glucose well. When you control blood glucose well, your triglyceride, which is a kind of fat which is most important, even that also comes down, and you not only end up with reducing glucose toxicity, but also can reduce the lipid related toxicity to the beta cells. And that is why you improve the health of the beta cell, and these beta cells then can really help you for a long period in a life span or a life history or a course of a type 2 diabetes in long term in future. And that is why not only that we should be giving rest to the beta cells, even early achieving blood glucose control for 6 months. Suppose someone gives a target of say 6.5 or 7. If you try to achieve it this in first 3 to 6 months, then for a long period we can have a patient has less risk of a microangiopathy, small vessel disease, or a big vessel disease. And that is why not only that you give insulin for a short period, but also try to achieve glucose control to the target as early as possible to save your different organs.
All right, so let's get in a question for those people who are new to this whole crisis, who've just been found out that they have diabetes. Newly diagnosed people, Dr. Ghosh, newly diagnosed people with the diabetes believe that if they eliminate sugar in their diet, they can avoid taking medications. What would your advice be regarding this, Dr. Sujoy Ghosh?
I think this is a very common myth, and it's a pretty loaded question. I'll try and target it into 3 small bits. The first thing is we have to achieve targets. The blood glucose targets, the blood pressure targets, and the lipid targets. How we achieve the targets is probably relatively less important. So it could be by changing lifestyle per se, and one of those components is, of course, diet. Now remember, the blood glucose increases because of increased energy intake. It's not just simple sugars, but everything else as well. So if you're talking about the fat intake of the diet, so if you're talking about advice in terms of dietary advice, we've got to have a balanced diet where we restrict calories, where we restrict fat and oil, and we also restrict simple sugars. That's number one. Number two, if other individuals think that in addition to the diet, they need medication, you should take the medication rather than thinking that, the medication is going to harm you. The third bit is there is a component of reversible factors in your lifestyle which can improve diabetes and help you achieve those targets, maybe even without medication. So if you're overweight, lose weight, be physically active, stop smoking, and improve your diet. So reaching the target is more important than how you reach it. Correct your reversible risk factors, and of course, cut down on your sugars, but it's not the most important thing. Calorie restriction and modification of the diet is more important than just getting rid of symptoms.
All right. So along the same lines, basically the same question in a sense, Dr. Singh, we're talking about reversing, diabetes in a sense, perhaps. Is it true that complications of diabetes can be delayed and even prevented? Many people sometimes ask that question, Dr. Singh. What steps can be taken to delay or avoid complications due to long-term diabetes, Dr. Singh?
Yeah, I think every patient is concerned about the complications. Maybe the blindness of the eyes, kidney disease, kidney failure, heart disease, even the peripheral arterial disease, many food problems, and lots of neuropathies. But my hope is that by doing simple things, you can prevent it and at least you can delay it. So first thing I will tell you, monitor the disease and have a regular checkup with your doctor. If not possible every month, at least at 3 months, number one. And get one HbA1c done at every 3 months. And this will, if you control or if you bring down the HbA1c, this has been correlated to prevent the microvascular complications. Apart from that, you must also control your blood pressure. That is I say the mantra of delaying or complications is the A, B, C, D, E. So A is HbA1c, second is the B is the blood pressure, your target should be 130 N80, and there are some compelling drugs to use in diabetic like ACE inhibitors or ARBs. The C is the cholesterol, that is the lipids. If your LDL cholesterol, that is the bad cholesterol, is more than 100, and then the recent guidelines are that it must be brought down by the use of the statin group of drugs. D is the diet and the drugs. Diet, I think Dr. Sujoy Ghosh has already mentioned. Diet is a very, very important role. And some drugs like SGLT2 inhibitors, these have I will say that revolutionized the whole treatment of the diabetes. And if there is patient is coming like he is obese, take a smoker, or having some albumin in their urine, then they must be started. This will halt the complications, and also you can even prevent the complication. The third last point is exercise. There are lots of research has appeared by doing regular physical activity, maybe 60 minutes every day, will definitely prolong your life. It will also delay your complications, and it can prevent your complication. There are lots of things about the exercise, but this is the best drug I will tell, which you are missing. Most of our diabetic patients are missing. So the things are the very simple thing is do exercise 60 minutes per day. Don't just restrict your that it will be only in the morning. Any time you do, I will rather say the afternoon exercise is equally good. And even the heat, that is the high intensity interval training for those persons who do not have time. This has been found to even the lower the HbA1c and also very effective in controlling the blood sugar. So if you simple things, if you do in your life, you can prevent it, you can delay it. The complications are very, very dangerous. So please take care. Thank you.
All right. And Dr. Gupta, a quick question to you before we go into a short break. Again, a generic question, but we hear a lot about this. Lots of viewers are concerned. They just ask, are there different treatment protocols for managing diabetes in the younger population as compared with the elderly population? Dr. Gupta.
Sarah, our audience should know one very, very important issue here. See, young person when comes to us, we know that this person has a lifespan of say 30 years or 40 years to live still. Someone comes to me at the age of 30, I'll say at least he has to be there in this world for next 40 years. And for that, we have to be very, very aggressive for achieving good glycemic control. So a young person who's coming to me without any comorbidity, without any complication, I will try to achieve I'll fix my target first. And I'll say that HbA1c should be less than 6.5 in this person. Fasting should be less than 120. Postprandial, I'll try to keep it less than 160. And I'll try to keep all your ABCD, blood pressure, their lipid profile, everything to be under very good control. Within 6 months, we try to achieve that so that the future complications can be prevented, because this person has to live longer and have to live healthy, and he has to be more productive in subsequent phase of their life. When it comes to an elderly person, the hypoglycemia is one of the most important aspect of treatment of elderly person. Hypoglycemia may precipitate, severe hypoglycemia may precipitate some of the complications like coronary artery disease or stroke in a patient. And that is why one should be very careful of using a drug in elderly people and should avoid. That is why the targets in elderly will not, HbA1c will not be 6.5, but it may be 7, sometimes 7.8. Someone comes to me at the age of 80 years, I am also comfortable with HbA1c of 8. I will not try to achieve a fasting of 110 or 120. I'll try to keep it around 130, 140. I'll avoid going below mean blood glucose of 100. I'll try to keep blood glucose of postprandial maybe near 200 to avoid hypoglycemia. So postprandial can be between 140 to maybe 220, and fasting can be between 100 to 140, and HbA1c around 7-8. So more number of comorbidities a person has, we have to, our control becomes little less, and we don't go for very tight control in such cases. So elderly people will be little more liberal for control. Younger people, we will be little more aggressive in achieving a good control. And that is why when some young person comes, I become very strict. When some elderly person comes, I become little soft and liberal to him as far as blood glucose control is concerned.
All right. Well, we're going to go in for a break. After that, let's talk a little bit about advancements in diabetes management. We'll save that for after the break. It's going to be a short one. Stay tuned. Welcome back. We are in that crucial, important conversation about diabetes. I'm quickly going to go across to our doctors. Dr. Ghosh, I was asking you before the break, what are the recent advancements in diabetes management? Because, we've been talking about this issue for so many years now. Can diabetes medications help in controlling parameters other than blood glucose? Dr. Ghosh.
Right. Very quick answer. First of all, there's been huge advancements in technology in terms of the way we monitor therapy, and of course the way we deliver therapy, and of course newer drugs. And quite rightly pointed out, in the past we've been using drugs which target only blood glucose control. Of late, we've got drugs like the SGLT2 inhibitors and the GLP-1 analogs, which not only reduce blood glucose but also improve weight issues, reduce blood pressure, reduce cardiovascular events, and reduce renal complications. So we've gone beyond a stage where we were only looking at improvement in blood glucose to a much more holistic management, wherein you target all of the associated comorbidities and prevent complications.
Okay, let me just check what other questions we have. Dr. Singh, why is there a vitamin B12 deficiency common in people with diabetes? Should a person with diabetes be taking these vitamin B12 supplements? Dr. Singh?
Well, this was a very controversial issue few years back, but now the American Diabetic Association has clearly said that the metformin, if you are taking, because metformin is one of the best drugs for the diabetes, due to some mechanisms, it can cause the vitamin 12 deficiency. So in that case, it has been suggested that annually we should go for the routine checkup for the vitamin B12, because it is as common as 25 to 30% of our diabetic cases. And if there are deficiency symptoms, then it must be treated. So that is the main reason regarding the metformin, which causes vitamin B12 deficiency. Thank you.
All right. Lastly, I have Dr. Gupta. I want to just squeeze in, just to reiterate, to wrap up overall as a message to end on, maintaining a healthy blood pressure, blood sugar levels and regular physical activity can help increase immunity to infectious diseases. Correct, Dr. Gupta?
Yeah, absolutely correct. Sarah, see, this COVID has taught us a lot of things. One is that we have seen that those patients who had uncontrolled blood glucose, they had more severe disease, they had higher mortality, they had higher morbidity, and then the recovery was also very slower. And the ICU admissions were more in those whose blood sugars were uncontrolled, whose blood pressures were uncontrolled. And that is why that has actually documented very, very clearly, and a layperson now knows that diabetes should not be taken lightly. Of course, one should not be taking stress of diabetes, but one should try to win over diabetes by controlling it very well. So keep the blood sugar normal. HbA1c should be less than 7 on an average. If the person is young, 6.5, elderly, 7.58. Second is blood pressure. Blood pressure again should be less than 130/80. If it is more than that, then it may cause the damage to the vessels. So should try to control that. LDL cholesterol has already been stressed on. So A, B, C. D is for diet control. There are good diets. They can improve the immunity of a person, and even that realization has come after the COVID. You can have turmeric, garlic, ginger, oats, tulsi, kiwi, lemon, avla, flaxseed, and whatnot. Lot of good data coming up. Small things, but our dietary habits should be changed, and we should try to involve those dietary functional foods which can really improve your immunity. Then, of course, the cholesterol, as I told you, we have LDL cholesterol, which is a bad cholesterol. You have HDL cholesterol, which actually prevents the coronary artery disease or any atherosclerotic or the blood vessel disease. So, for increasing HDL cholesterol, Sarah, you have only one drug in this world which is proved, and that is physical activity and exercise. So if you exercise for around 150 minutes per week, 30 minutes per day for 5 days a week, maybe anaerobic exercise for 2 days in a week, that will improve your immunity and will improve your HDL cholesterol, so that you can save yourself from diabetes complications.
Well, thank you all. Thank you, doctors, for your time. Thank you for your service. Lots of information here for all our viewers. Thank you all for joining us. Bye-bye.